A very warm welcome to each and every one of you on the Vishwashanti Darshan channel. We are here today in our campus for a very special reason. We have been bringing for you videos on spirituality, on philosophy, on peace. Today, we are here with a very special guest who has visited our campus. I speak about none other than the very esteemed surgeon who is the top of his field. And believe me, he has created a niche in the kind of surgery that he does. Let me introduce you to Dr. Raman Goel. A very warm welcome. Thank you so much for being in our studios today. You have also had the, I would say, good fortune of being in our campus today. I am going to bounce back to that question in the end. But as you know, the Vishwashanti Darshan channel is all about spirituality, it's about peace, it's about philosophy. You are a doctor. How do you find these things connected with your profession? How did you start? Did you come into this with the intention of being a surgeon, of going into medicine? Was it by default or by design? So I think to begin with, I've asked you about 5 questions together. So your answers, please.
So I think as far as peace and spirituality is concerned, that bothers everybody. I don't think surgeons are anybody different than the usual people. We are also worried about the health of individual, health of the society, and health of the nation. And once I came here today to Pune to visit this beautiful campus, I realized that how much development is happening in this area. The Peace Dome that I visited is an amazing piece of architecture. And not only that, it has been designed in a way that it's so serene inside. You feel that you're connected to all those people whose statues and quotes are there on the walls. So I think more than as a surgeon, I think as a human being, I feel really humbled, and I feel good about being a part of this nation where such developments are happening, and they are going to play a big part in the development of this nation.
Thank you so much for that, Dr. I also wanted to ask you, I think in India, everybody and their parents, they want their children to be either an engineer, a doctor or a lawyer. The trend is slowly changing. So when you first took your step into the field of medicine, was it because of your parents' wishes, or did you consciously want to do something for yourself in this field?
So I am a 3rd generation doctor. My grandparents were doctors, both sides, and my father was a doctor. So for me, it was a natural thing to happen, because we were staying in the hospital campus and we saw them working every day. And for me, it was a no-brainer that I will go for medicine, because I knew that it's a very good profession. It connects us to different kinds of people, and it gives a kind of satisfaction which I didn't know about other professions at that time will give. It's not about financial, but it's more about a sort of interaction that would happen with my mother and the patients and the patient's relative, and my father and the patient's relatives, how they were helped. And I knew that they were good people and they helped so many people. So I thought medicine is a very good profession for me. And yeah.
Very true, because I think in our country, the most revered professions are that of a teacher, the guru and the doctor. So one saves your life, one molds your life. And I think that's what you saw firsthand, since you're saying you're a 3rd generation doctor. I know you're one of the leading laparoscopic surgeons in the country, but you've started a completely different niche, and that is bariatric surgery. And it has taken our country, our visionaries, our lawmakers in the country to realize it as a life-saving surgery. So tell me a little bit about that path, about why did you choose bariatric surgery, and how have you created that niche, and how has it really benefited all the people around?
Yeah, so I didn't know that bariatric will be such a big thing in our country. So why did I choose bariatric surgery? So primarily, I always believed that opportunities come in everybody's directions. And you need to keep your eyes and ears open to grab those opportunities. Those who lie down under a mango tree waiting for a mango to fall in their mouth are going to lose that opportunity. So probably I was one of those who raised the hand and picked up a mango. And that is how I initially thought that bariatric will be one part of my surgical training, and it will never overtake everything else. But within 10 years, I have given up all general surgeries and I do only bariatric, because it has grown so much with the effort of all of us, in this field. So I think bariatric surgery has played a major part, and now to the extent that this is the only treatment modality for obesity or diabetes that is fully paid by the insurance and also by the governments, because they realize it's very effective. So I think that's how I took bariatric, and I have never repented that.
I'm sure, because I've had the good fortune of meeting quite a few of your patients as well, and they have claimed that it's a completely life-changing surgery. And for every doctor is revered. You feel thankful for whatever a doctor does for you. But I think what bariatric surgery does is not only the physicality of the person, but even the mentality and the outlook of the person, which changes. So I think that's something absolutely brilliant. So congratulations on that. And I would also say you were the head of the Bariatric Association. You were the president of the association last year. So you travel a lot, you go for a lot of seminars, national and international. You've kept yourself abreast with the latest techniques of what's happening in the field of surgery. What are your opinion about the younger generation of doctors, especially your fellows who are joining you and who are training under you? Because right now, I think you're the Bhishma Pitama of bariatric surgery. So you must be having a lot of doctors who want specially to come and train under you.
So I think it's a process. Even now I am getting trained. People may call me by any success story, but I believe every youngster or senior need to keep on upgrading their skills throughout their lives. So success is not a destination, it's a journey. And I remember when I started my surgical practice, when I did my first surgery, I was so happy, probably more happy than if I do 50 surgeries a month. So I think I felt I'm very successful, almost 30 years back, because I did my first endoscopy of first surgery. So it's a gradual process, and a lot of youngsters are coming forward, and I'm happy that majority of them are very focused now. They are not in a great rush to start earning or to be called a specialist. So more and more people are ready to spend time, years, not months or weeks, with us or with other senior surgeons to learn the art and the science of surgery, which is so important because we cannot afford to make mistakes.
True.
We are like pilots of an aircraft who cannot afford on him. There is a burden of 300, 400 passengers. For us, every patient is like a passenger, and we need to deliver them safely to their family. So I think I'm very happy with the young generation. Probably we were not so good at that time, but I'm very, very happy and very positive. These people are going to take our specialty to greater heights.